Hey, welcome to the Summerly Dental YouTube channel. My name is Dr. Taha Jomha, and today I'm going to help you decide which toothpaste you should be using. Keep in mind my recommendations are based on my personal opinion, but of course also my clinical experience from the last 13 years, as well as scientific knowledge. Please make sure to like and subscribe this video to help support the channel. Here we go. For the average person, choosing a toothpaste is actually relatively simple. I always tell patients, just choose the one that tastes the best and has the most pleasing texture. At the end of the day, the majority of toothpastes available on the market are going to contain a seal from the Canadian or the American Dental Association. As long as it has that seal, it's going to have everything it needs to help prevent cavities and keep your mouth healthy. So how does toothpaste actually work? The majority of toothpaste are going to have three main ingredients common to them all. The first one is fluoride, that's what helps to prevent cavities. The second is an abrasive, usually calcium carbonate or silica. That's what actually helps to create the grit that scrubs the plaque off your teeth. And then the third is usually a detergent that creates the foaminess, helps to dissolve some of the plaque in your mouth and just makes it more efficient. Of the three components of toothpaste, fluoride is by far the most important one. Fluoride, when dissolved in our saliva, actually helps to remineralize our teeth. It also hardens our enamel, making it more resistant to the acid caused by the bacteria Strep mutans that's found in all of our mouths. In order for toothpaste to be effective, it needs to have a minimum of 1,000 parts per million or 0.1%. Good news is, majority of toothpaste on the market are going to contain at least that amount. Keep in mind that the number you see on the toothpaste bottle doesn't necessarily mean how much fluoride there is. For example, the most common toothpaste on the market is going to have a percentage of sodium fluoride at 0.243%. What this actually translates to is 0.15% of actual fluoride available in our saliva. That's still well above the 1,000 parts per million minimum. There are a few other considerations when choosing a toothpaste. For example, if you have sensitive teeth, there are toothpaste specifically designed to help combat that sensitivity. Out of sensitivity toothpaste, there's 3 or 4 different ingredients available on the market, and one might be better for you than the other. In general, I recommend Sensodyne products to my patients, which contain potassium nitrate, the most common ingredient to combat sensitivity. There are other patients that may benefit from a high fluoride toothpaste. These are toothpastes that have significantly higher concentrations of fluoride to help prevent cavities in patients that are just prone to more cavities. I don't recommend taking one of these toothpastes without first consulting with your dentist. What about fluoride-free alternatives? I do have some patients that are simply not comfortable consuming products that contain fluoride. While it's important to note, there is overwhelming scientific research to support that fluoride is completely safe for use in toothpaste, especially at the low concentrations that are available. However, that being said, I do respect these patients' opinions. What I recommend for these patients is to find a toothpaste that doesn't contain fluoride. There are actually quite a few options out there now. One brand that I've personally used and I find to be tasty and also that it has enough grit is from a brand called Weleda. They've got various different flavors and all of them are plant-based. Another option, which is one that I more so recommend to patients, is a product called Cario by Oral Science. The reason why I tend to recommend this one for my fluoride-free lovers is this one contains an ingredient that does have some anti-cavity or anti-cariogenic effects. This toothpaste contains an ingredient called xylitol. Xylitol might sound familiar because it is found in most sugar-free gums such as Trident, and it's also found in a lot of sugar-free mints. Xylitol, being a sugar alcohol, will actually help to stop or slow down the growth of the bacteria that's responsible for cavities. Now for my all-around favorite toothpaste. So this is a toothpaste that I use both for myself, and my wife uses it, also my kids, and it's also the toothpaste that I recommend the most in my practice. The toothpaste of choice for me personally is Pro-Enamel by Sensodyne. What I like about this toothpaste is it has a higher concentration of available fluoride, so the fluoride that's actually in our saliva doing the work. And it's also a really good tasting toothpaste, and for people who have sensitive teeth, it has that ingredient built in. Traditionally in the past, if somebody used a sensitivity toothpaste and another household member didn't, they would probably use different toothpaste because sensitivity toothpaste were notorious for being bad tasting. This one, however, you can't even tell that there is that extra ingredient. The potassium nitrate that is in this toothpaste is only recommended for ages 12 and up. However, they do make a children's version, Pro-Enamel Kids, or children, and with this toothpaste it's the exact same thing except the mint flavor is a little bit more mild for our little ones, and of course it doesn't contain the potassium nitrate. This is for ages 2 to 12. Just keep in mind, if you are a youngster out there and you're not able to rinse and spit, you are only supposed to use a grain of rice size amount of toothpaste, and as soon as you're able to rinse and spit, you can switch to a pea size amount. Adults can use a pea size amount or more depending on preference. I hope you learned something today about toothpaste. Please post your questions or share your comments down below, and please, if you enjoyed this video, please like, subscribe, and share to help support this channel. Until next time, thank you. I'm Dr. Taha Jomha from Summerlee Dental.